Good evening, everyone. We hope all of you are fine. I am Dr. Sachin Kumar, dermatologist practicing at Khushi Hair Skin and Aesthetic Clinic, Delhi. Today we are going to talk about urticaria and its trigger, which help us to understand the disease better. If one had red or skin colored bumps that appears and disappears usually, then it's not a simple bug bite. The rash could be urticaria. Urticaria affects nearly 20% of people at some time during their lives. Now we are going to talk about urticaria. What is urticaria? Urticaria presents as wheals. Wheals are transient erythematous papules, plaques, usually pruritic, and causes edema of papillary body. Urticaria could be acute recurring or chronic recurring. There are different forms of urticarias like IgE receptor dependent, physical, contact, mast cell related, and idiopathic. Now we are going to talk about acute urticaria. Acute urticaria has acute onset, recurrent over the less than 30 days. Often they are immunoglobulin dependent, related to foods, parasite, and medications. Chronic urticarias are recurring over more than 30 days. Etiology is unknown in 80% of cases, and therefore they are considered idiopathic. Symptoms of urticarias are they show sharply demarcated wheals. They are small to large in size, erythematous or white with an erythematous ring. They have different shapes like round, oval, acriform, annular or serpiginous. Lesions are pruritic and they are transient. Now we are going to discuss about the special features of different urticarias. Like immunologic urticaria, it is IgE mediated. Mast cell and basophilic leukocytes play important role. Other is complement mediated urticarias. It is due to immune complexes. It causes mast cell degranulation. Third is immunologic contact urticaria. They are seen in children with atopic dermatitis. They show sensitivity to grass, animals, latex, and rubbers. Now we are going to talk about physical urticaria. There are different types of physical urticarias like cold urticaria, solar urticaria, cholinergic urticaria, aquagenic urticaria, pressure urticaria. Cold urticaria occurs on exposure to cold. Like if we use ice cube on the skin, it will show urticaria. Solar urticaria, it occurs after sun exposure. Histamine is the mediator. Cholinergic urticaria. When one goes for exercise and there is sweating, then it may cause urticaria. It is known as cholinergic urticaria. Now we are talking about aquagenic urticaria. It is rare. Contact with water of any temperature causes urticarial eruptions. Now pressure urticaria. Pressure urticaria is erythematous swelling caused by sustained pressure on body parts. Now we are talking about the diagnosis. Diagnosis is very important. A detailed history is very important. History of previous disease, drugs, foods, parasites, solar exposure, physical exertion is very important. Duration of lesion is also very important. We also see about the conditions of pruritus, flushing, burning or wheezing. History of medications is also plays very important role like penicillin, aspirin, NSAIDs, ACE inhibitors should be asked to the patient. Now course and prognosis of urticaria. Half of the patients with urticaria are free of lesions within a year, but more than 20% have lesions for more than 20 years. Management of urticaria is very important. Like first of all, we must prevent the etiologic factors like chemicals, drugs, food addictions. These are antihistamines. Antihistamines play an important role. They are also on the first line of treatment like H1 blockers like hydroxyzine, cetirizine, fexofenadine, loratadine. If H1 fails, then we add H1 and H2 blocker, that is cimetidine or ranitidine. Or along with them, we can also add mast cell stabilizers like ketotifen. Doxepin, which is a tricyclic antidepressant, can also be added in case of urticaria. Steroids like prednisolone, methylprednisolone, Devzacort are also used when it is very severe. Other drugs like danazole and stanazole are also used. Cyclosporine, it is a steroid sparing drug which can also be used in case of steroid dependence. Very new thing is omalizumab. It is present as an injection. It is a monoclonal antibodies. Okay, these are the medicines which are used in the management of urticaria. For severe urticaria, one must consult dermatologist as early as possible. Thank you and good night.